Hi, I'm Robert Rowland. I had to take opiate painkillers every day for 9 years, 3 times a day. Started with hydrocodone until the Biden administration passed quotas on it, limiting manufacturing, and all of a sudden, myself and hundreds and thousands of other people could no longer get the drug because of the lack of availability. So then I switched to oxycodone. And both those drugs, by the way, have acetaminophen, prescription strength Tylenol in them. And that stuff is horrific for your liver. It's the number one cause of liver failure in the United States. But I had to take it just to cope with pain. I was unable to take prescription ibuprofen or prescription anti-inflammatories because they caused me to have intestinal ulcers. So I really was pigeonholed into only being able to use one kind of drug. However, I got a spine cord stimulator put in a few months ago, and now I don't have to take pain medicine because those pain signals, are being blocked electronically in my back. And so I was able to quit. 9 years of opiates 3 times a day with zero side effects, no withdrawal symptoms. I never was habituated, as they say. So, vitamin D is the secret that kept me from getting addicted to opiate drugs. And, instead of the government regulating the quantities drugs that can be produced, they ought to pass a regulation that these drugs in future runs of the pills have to include vitamin D because it would help people not get addicted to the drug. So instead of, it's kind of like gun control. If you take guns away from all the people who use them lawfully, then those people are no longer able to protect themselves, but the criminals are still going to find a way to get guns. Well, people who are going to abuse drugs will still find a way to get them, but if we could make sure that all the drugs out there had vitamin D in it, then it would make sure that people didn't get addicted to it by and large. Now, this is based on a new study that came out, and you can see the study and several other studies and papers on it in the notes to the show. So I'm not going to bore you with the names of the studies and read their authors. You can look that up for yourself if you're curious. I just want to give you the final results and tell you what kept me from getting addicted after 9 years. Vitamin D is something every person that's in chronic pain should be taking all the time. Now, the opioid crisis is real. I don't mean to make light of it all. In 2021 in the United States, there were 15.4 deaths for every 100,000 people, while in Canada they had 6.9 deaths for every 100,000 people. And so there are people who die, there are families whose lives are changed, and it's a pain that will never go away. Now, by the way, we have discovered that you are 90% more likely to become addicted to opiate drugs if you have extreme vitamin D deficiency. And I'll show you a chart on that in a little bit, but basically if your number in the United States, your vitamin D score is under 20, or if in the UK, if it's under 50, then you have an extreme deficiency. That means that you don't have adequate vitamin D level just for your normal hormonal processes in your body. Vitamin D is actually not a vitamin, it's a hormone. One of my other videos on vitamin D and the immune system talks about why we call it a vitamin instead of a hormone. Basically, vitamins are thought to be things you have to take in through your diet because your body can't make them. But then later, after we're calling it a vitamin D, we discovered that if you're out in sunlight, your body does indeed make its own vitamin D. So it's a hormone and not a vitamin, but the name stuck. And that's fine. But the opioid crisis devastates families and communities. I don't make light of it, but wouldn't it be interesting if you could prevent this problem with one simple nutrient, and that would be vitamin D? Let me explain why vitamin D works in this way. One of the things vitamin D does is it regulates opioid receptors. So your cells have these receptors on it. The receptors can take opiate drugs or opioids of any kind, and they can attach to these receptors, and then the nerves don't feel as much pain as they once felt. Well, vitamin D basically is like the key master that can open or close those receptors to make them available to receive opiates or not, and also control how fast gets in, and whether or not you you hyper respond to the opiate. So people who are addicted, they don't have that vitamin D there to protect the cells receptors, and so they very often hyper respond. So they get a little bit of a high off of their painkiller, and that's the thing they get addicted to. Now, I never felt a high on 9 years of those pills, but I had high vitamin D level for all 9 years of those pills. The second thing is that when those receptors are kind of locked shut or become unavailable, your body responds by cranking up its own opioid manufacturing. I have trouble saying opioid, so forgive me. But your body makes what are called endogenous opioids. Endogenous is a college word for stuff that our body makes inside of itself. And so your body will start making natural painkillers. We usually call this endorphins, but your body makes endorphins, it makes dopamine, it makes serotonin. Those are kind of our feel-good chemicals. Your body can even manufacture to some degree forms of morphine. So when the body makes its own stuff, that means you don't have to take so many things from a pill bottle. And then it affects reward pathways. It balances dopamine. Dopamine's that thing that ramps up when we feel rewarded by something and falls down when we feel like we're being punished for something. And in people who take opiates and they're abusing them, they're basically abusing this reward pathway. But vitamin D basically tells dopamine to hey, we're doing something healthy here, we're rewarding ourselves, we're taking care of ourselves, you should feel good. Dopamine ramps up, and then there's not as much tendency to get addicted to the vitamins. So vitamin D affects over 3,500 processes in the body. So this is just a very small picture of what it does, but this is a crucially important piece to people who have to take opiates. Now, there's evidence for all this. This isn't just something I made up for the purpose of a YouTube video, and you can find the evidence in articles and stuff listed in the notes for this video. But basically, in animal studies, they took mice that had a very, very low deficiency, or had an extreme deficiency of vitamin D, and discovered that they became very sensitive to morphine and opiate drugs, and they developed a quick dependence, and they became quickly addicted. When they took those same mice then and started giving them vitamin D and ramping their vitamin D up, the animals quit being addicted to the drugs. In human data, they found out if you have a score lower than 20, you have a 90%, this is U.S. numbers, a 90% likelihood of becoming addicted to opioid uses or misusing it. If you have a mild addiction, that would be a number under 40 but greater than, if you have a mild deficiency, that'd be a number greater than 20 but less than 40. You have about a 50% likelihood of becoming dependent on opiate drugs. Now, in the clinic, they have found out that people with what they call opioid use disorder consistently have very deficient or extremely deficient vitamin D levels. Now, they've also found out that with what they call palliative care cancer patients, if you're not using the word palliative, some cancer patients get told by their doctor that their cancer is incurable. They need to go into hospice. They need to keep themselves comfortable until the end of their life comes. That process of keeping a patient comfortable until they die is called palliative care. It just means let's let them leave this earth as comfortable as possible and as happy as possible, and hopefully surrounded by their family. Well, they've discovered that if you raise those patients' vitamin D levels, you can keep them comfortable with lower doses of opioid drugs. And the vitamin D makes the drugs actually more efficient than they would be otherwise. So you need to optimize your vitamin D level just for your health. Again, used by 3,500 processes in the body, so it's good to have good vitamin D levels. But to do that, you first of all got to know where you're at. What's your level now? So you need to get online, find one of those labs near you. You can order a vitamin D test, or you can go to your doctor, ask him to take a vitamin D test, because it'd be useful for him to know what this is. And unfortunately, most doctors do not test for vitamin D unless you ask them to. Now, I go to a functional medicine doctor, and that's the first thing he tests for because he knows how important it is. But most doctors went to medical school. They don't understand nutrition. They don't really understand vitamins, and they don't really understand the hormonal role But you can request what's called a 25-hydroxy vitamin D test. Sometimes you'll see it abbreviated as you view there on the slide. It'll be 25-OHD. But if you order that test, it will give you a response. Now, in the United States, that response is in nanograms per milliliter, and in the United Kingdom, it is expressed in nanomoles per liter. Basically, if you take nanograms per milliliter and multiply it by 2.5, you will get the nanomoles per liter. So I'll show you that more in just a minute. Now, once you find out if you're deficient, you need to correct that. And if you're severely deficient, you need to correct it quickly because you are an illness waiting to happen at that point. So doctors often recommend that for a patient severely deficient, you can get some 50,000 IU capsules, or you could take 10,000 a day, but you want to get 50,000 IU vitamin D weekly for 8 weeks. And I do have 50,000 IU capsules. I take mine on Sundays, and I don't take vitamin D the rest of the week. Vitamin D goes into the fat in your body. It's stored in fat tissues, so it has a long half-life, unlike something like vitamin C, which is water soluble, which means that if you take 2,000 milligrams of vitamin C, which is about the most you can take at one time and process, but any vitamin C your body doesn't use in the next 4 hours gets peed out, and then you need to take more vitamin C if you really need it. Well, vitamin D has a long half-life, so if you take 50,000 IU on Sunday, by next Sunday, a good amount of that is still in your system. So doctors will recommend that you take 50,000 IU once a week for 8 weeks, or you could also just take 10,000 IU a day. You do that for 8 weeks. You have your numbers retested. Once your numbers are in the range your doctor wants them, and my doctor wants my number to be between 70 to 90, then you can go down to a maintenance dose. And usually 2,000 IU per day is enough to keep your vitamin D level at the right level. So you want to maintain those levels the best you can. So what do your vitamin D numbers mean? Again, in the United States, we express this as nanograms per milliliter. The UK is nanomoles per liter. And if you take any of those numbers on the left column or the middle column here and multiply them by 2.5, you'll get the numbers in the right column. So let's discuss these ratings. In U.S. terms, if your score is less than 20 on your 25-hydroxy vitamin D test, you're dangerously low. Again, this is a hormone that's used in 3,500 processes in your body. So if your vitamin D level is that low, your body is not functioning the way it needs to be, and you need to correct this situation immediately. Now, remember, vitamin D was actually discovered initially because they found out that people that didn't have this thing got rickets when they were on shipboard, and that they needed to be taken out of the bottom of the ship. They needed to be given sunlight because without vitamin D, you get rickets, which deforms your bones. So it's dangerously low. Now, if you got 20 to 39, and some people would say 20 to 30, but I think 39 is a better number here, you need supplementation because those numbers are not high enough for good health. So you probably need to be taking a vitamin D capsule. But maybe instead of having to take 50,000 IU a week for 8 weeks, you can start out, maybe taking 5,000 and then cut down to 2,000 at some point. Your vitamin D is adequate if it's above 40, and we would say 40 to 69 would be adequate. That means if you're at that number, you're probably in good health. You can kind of work with your doctor to determine if he wants to see the numbers higher. If he thinks you'd be okay just taking 400 IU a day or 800 IU per day just to keep the number there, then you can do that. My doctor wants me to have optimal health, and for him that means a number of 70 to 90. And so when I get my blood tested, it'll be there. And quite frankly, I've several times had mine go over 100, and the doctor said, well, maybe you want to lay off the vitamin D a little bit, in which case I'll cut back the dosage. Now, interesting enough, there have been studies of tribes in Africa where their vitamin D levels were over 200. And yet they had zero problem effects with any of that. Now, so you don't have to worry about having a high number as long as you know that you should never take vitamin D alone. You have to take it with something. And what you have to take it with is you have to take it with vitamin K2. So let me talk about that in a minute. The reason you don't want to take vitamin D3 by itself, and by the way, there's D3, there's D2, and then there's calcitriol. D3 is the form you take in a supplement. It's also the first thing your body kind of takes sunlight and changes into D3. And then these things in your body called macrophages turn D3 into D2. Doctors can give you a shot of D2, but it's not well absorbed. But they can also give you a shot of calcitriol, which is the form the body actually converts everything to and breaks it down to, and you can use it. So if you have an emergency that vitamin D needs to be boosted today, or something horrific is going to happen, they'll give you a shot. But there's three kinds of vitamin D. We're talking exclusively about you supplementing with vitamin D3. That's the kind you want to take. Now, similarly, there's two kinds of vitamin K. There's K1 and K2, and most doctors are confused about this. They say, oh, don't take vitamin K, it'll make your blood clot. Well, that's not true. K1 makes your blood clot. K2 has an entirely different function. You will not become at an increased risk of clotting because you're taking vitamin K2. Just don't take vitamin K1 unless a doctor tells you to. In other words, if you're a hemophiliac, you've got a problem, then you might need to take K1. But people shouldn't take K1 without a doctor telling them to do so. Well, here's why you need to take the two together. It has to do with calcium. Vitamin D3 takes calcium out of our diet and puts it into our bloodstream, which means that calcium is pumping through all our veins and arteries. The problem is calcium is a mineral. Think of it as a rock that you find on the side of the road. You don't want your arteries and veins becoming rock hard. That's called hardening of the arteries, or it could be arteriosclerosis, which means building up plaque inside the arteries, or it could be called calcification of the arteries. So when you go to a doctor and say, I want to find out my coronary calcium score, they will either use a CT scanner, or preferably they use something called electron beam tomography. They'll take a picture of your heart. They can actually see the plaque on the picture and tell you how thick the plaque is. So I went in for my last coronary calcium score, which you ought to have done every couple of years once you hit 50. You want a score ideally of 0, which means no plaque at all, but it's typical that at age 50, your score starts going up by 3% a year. And so I went from 100 to 104 to 111, but now it's actually going back the other way because I'm taking a larger dose of vitamin K2, and that's bringing down that plaque. Well, D3 takes calcium out of your food, puts it in your blood. K2 takes it out of your blood and puts it into your bones and teeth where it belongs. See, we don't want those rocks running around and making our arteries harder, because then we get heart attacks, we get strokes, and bad stuff happens. What we want is for all that calcium to leave our blood and go into our bones and teeth. So after I've been taking K2 for a few years, I went to have a bone density exam, which is one of those tests you take when you get older. And they told me, it says, Robert, you are never going to break a bone if you fall. Your bones are harder than just about any we've seen. And I did take a horrific fall out of the back of a van, landed on my head on our driveway, and it was the worst fall I've ever taken. I got a grade 2 concussion because my brain got rattled around inside of my skull. It was the worst headache I've ever had, and it took 3 months to get over the headache, and that was taking strong drugs. But there were absolutely no cracks on my skull, no cracks anywhere in my spine. I didn't hurt anything in the fall because my bones were so strong. I've also, right after I started taking K2, I went for an exam, and the dentist said, well, you've got a little cavity back here. It's no big deal. We can take care of it later. Next time I went back to the dentist, I said, let's go ahead and take care of that cavity you found last time. He looked around and said, there's no cavity here. Your teeth can actually repair themselves if you take enough vitamin K2 that it's putting the calcium into your teeth. So if you take D3, you're getting calcium out of your food into your blood. K2 takes it out of your blood and puts it where it belongs, which is in your bones and teeth. That makes you have higher bone strength. It also means your heart's going to be healthier. Now, a good ratio here is for every 10,000 IU of vitamin D3 you take, you should probably take about 200 micrograms. Microgram is mcg. I take about 200 micrograms of K2. If you're taking 5,000 IU, you should probably take about 100 micrograms of K2. And most K2 comes in pills that are either 90 or 100 micrograms. So in other words, if I take 50,000 I might want to take, 5 to 6 of my K2 pills at the same time. Now, just make sure you always take them together. Never take one alone. Taking vitamin D3 by itself might sound noble, and that might be all your doctor talks to you about, but that's nutritionally dangerous to do. Now, by the way, this is a freebie, but I did go in to see Dr. John Duncan. He's a research scientist. He created the technique of using what's called electron beam tomography to scan your heart and look for calcium deposits. It's very accurate. It also finds cancers as small as 1 millimeter. It's probably one of the best tests that you can have, but insurance won't pay for it. So I go in every couple of years to do that test. And my score as a 62-year-old man was 111, and I just happened to ask him the question, is there anything you can take to actually cause that score to go the other way? Because typically, once you hit 50, it goes up by 3% a year. 0 is a perfect score. Anything higher is not good. I had friends that went in and their score was 400, which basically 400 is kind of the limit where anything 400 or higher means that you're in serious danger of having a heart attack at any moment. So you don't want to see your score go that high. 111 for a 62-year-old man is considered to be in the lowest percentile of risk for a heart attack. But he told me that if there's new research that they have discovered that if you take 800 micrograms a day, which for me is 8 of those little pills of vitamin K2, it can actually remove plaque from your artery. And there was a more recent study just within the last few months that showed that if you take 1,500 milligrams a day of berberine, berberine is an Indian herb that a lot of people use to replace metformin. A lot of doctors will help people get off of metformin and onto berberine because metformin can have side effects like bad, severe headaches, whereas berberine doesn't have that. But they're now also saying that berberine actually causes, over the period of 12 to 48 months, causes the size of plaque in your arteries to be reduced. So in other words, by taking K2, by taking berberine for a lengthy period of time, you can actually start to reverse arterial plaque, which is pretty amazing. Now, let me cover one other thing. One other way to not get addicted to opiates is to take something else instead. But as I said, I couldn't take the standard anti-inflammatory drugs like prescription dose ibuprofen kind of stuff. Well, there's a drug called Low-Dose Naltrexone, or LDN, and most doctors know what LDN is. Sometimes you have to spell it out for them. But you probably watched a TV show where a cop finds somebody who's OD'd on heroin, and they quickly run to their car and bring back a kit that has a drug called Narcan in it. Sometimes this is a nasal spray, sometimes it's an injection, but you give them the Narcan, you give it to them very fast, and it saves their lives. Well, Narcan and LDN are the same drugs at 2 different levels of potency. So when somebody's OD, you give them a very strong dose of this, and basically the Narcan pushes the heroin off of the cells and locks the cells up so the heroin can't have any effect on them. I have a son-in-law who's a police officer, and he not only carries this in his police vehicle, but he has this drug in his personal car as well in case he finds anyone that has this problem. Well, LDN has been around for a long time. It has 0 toxic effects. It has 0 tendency to become addictive. It has extremely anti-inflammatory things, and inflammation is what causes most of our pain. So if you can lower the inflammation, that works. But LDN basically attaches to the opiate receptors and makes it where those opiate receptors don't want opiates anymore. And fact is, if you are on LDN, LDN is normally taken at night before you go to bed. If you wake up and maybe there's severe weather in the area and you're one of these people that has weather-related pain, and I feel you because I can tell the weather better than Google. If you have weather-related pain, you might want to take, let's say, a Tylenol 3 or a Tylenol 4 or oxycodone or something to deal with the pain. It needs to be 12 hours apart from the LDN because both are going to attack the opiate receptors on your cells. And so if you took LDN and tried taking oxycodone 3 hours later, chances are the oxycodone is not going to help you a lot. But this is a great drug. to that your doctor would probably be willing to prescribe because it's not habituating like an opiate drug is, and yet it's anti-inflammatory. It will help with pain. Typically, doctors will start you at 1.5 milligrams, then they go to 3. Most of the time, they'll leave you at 3, but if you're a bigger guy, they might try to bring it up to 5. But they're going to monitor you while you're going through the process, make sure there's no adverse results. Well, this all boils down to doing a few practical things really well. For one thing, anytime you can get out in the sun and get some sunlight, it's great to do. Quite frankly, to have fully adequate vitamin D levels, you would need to live at the equator and go without your shirt for 2 hours a day. We can't do that here in my part of Texas, and right now there is no sun out. The skies are gray. It's raining. Nobody's going to get vitamin D going outside today, so you need another source to do that, which is why I use supplements. But pretty much anybody, I would say, above South America, anyone in the northern hemisphere is probably not going to get. If you're above, there's the Tropic of Cancer and the Tropic of Capricorn, which are lines on either side of the equator. I would say if you're outside of either of those tropic lines, even in the summer, you're probably not going to get enough sun to have good vitamin D. But you can eat fatty fish. Some good examples there would be sardines are a really good example. Salmon is a fatty fish. And your grandmother probably used to take a spoon of cod liver oil every day to stay healthy. And what she was doing was taking a very powerful form of vitamin D3 and vitamin A together, because that's what's in cod liver oil. And consequently, people took that nasty spoonful of oil, didn't get sick. So you might be better just buying cans of the cod liver itself and eating them, because if you like oysters, you probably like that. Or if you like kippers, you probably like that. But that's a good way to get dietary vitamin D. And obviously, anytime you can get a vitamin from food, that's the preferable way. But there are good high quality vitamin D3. I would recommend that if you're taking D3, go ahead and buy a pill that has D3 plus K2 in one pill. That way, you always know every time you take your vitamin D that you remember to take your K2 as well, because it's in the same pill together and it will already be in the right concentration. So you can go to Amazon, look up D3 plus K2. You'll find a bunch of options there. Order one of those. And then maybe talk to your doctor about the possibility of reducing your opiates, getting on LDN, so that you're taking something that's not habituating. Now, vitamin D is more than just a vitamin. In fact, it's a hormone. It works 3,500 processes in your body, but it is something that is a powerful hope for people on opiates or opioids to not get addicted to those things. You want to get optimal levels. Go get your test. Talk to your doctor about what an ideal value is. He'll probably say 40 to 60. My doctor would say 70 to 90. But you're not only keeping from getting addicted, but you're probably helping a whole lot of other things in your body. Watch my video on vitamin D and the immune system to understand more how these work together. Now, in the notes, I have the references to the articles from PubMed and other things about how vitamin D helps prevent addiction to opioids. I want to ask you, if this has been helpful to you, please click the like button on this video to let people know it's been helpful to you. They'll see the videos, see it. Hey, that must have useful information in it. They'll watch it. Subscribe to the channel, because we not only deal with health issues here for people 50 and over, but we also deal with social issues, career issues, money issues, relational issues that also affect the 50 and over crowd. And click that notification icon. That way, every time there's a new video, which there's probably 1 to 3 new videos a week, that will let you know when those things happen. Thank you so much for your valuable time listening to this, and God bless.